The health of women and children is the barometer of measuring the health of any nation. It is against this background that the government of United Kingdom conceived and actualized the Women for Health program to improve access to quality healthcare delivery services, especially in northern Nigeria. Women for Health aims to address the acute shortage of female health workers in 6 states in northern Nigeria. Since November 2012, Women for Health has increased the number and capacity of female health workers in Kano, Katsina, Jigawa, Zamfara, and Yobe states, while at the same time contributing to women's empowerment and gender equality in communities and institutions in the north. It is expected that the increase in number of female health workers will lead to improvement in women's access to and use of health services in northern Nigeria and improve universal health coverage, UHC. Borno State, being the epicenter of the Boko Haram insurgency, is one of the worst states in terms of highest maternal mortality due to less number of female health workers, coupled with poor capacity worsened by adverse effects of the insurgency on the health sector in the state. To change this narrative, Women for Health came up with various strategies to scale up the number of female health workers in order to strengthen the healthcare delivery services at rural communities and densely populated internally displaced persons camps in the state.
Actually, our goal in the program implementation in Borno, as you know, we have been in existence since 2012, and we have been working in 5 of the other states of the country, especially the northern part of the country. We have worked in Jigawa, Kano, Katsina, Zamfara, and Jigawa. The main goal of Women for Health is to increase the number of skilled birth attendants so that they can be able to address the high maternal mortality and child mortality in the northern part of the country. And the intent of the program is informed by the research and the root cause analysis conducted, that one of the reasons why we have high maternal mortality and then low facility delivery is because we don't have enough female health workers to run our facilities, especially in the rural areas where most of the maternity and child mortality occurs. So as a result of that, the United Kingdom Foreign Commonwealth and Development Office, they call it FCDA, decided to fund the program to ensure that, or we demanded that we increase the number of female health workers in the 5 states so that they can be able to go back to their communities and help their people overcome those issues.
This foundation year program, we pick the indigenes of those areas. If you are from Munguno or you are from Abadam, we picked a midwife, the foundation year program candidate from Abadam local government. And we ensure that she's either married in Abadam, not that she's in Maiduguri, or we don't pick my own daughter or somebody's daughter to do the job. We pick somebody who is in the rural area. By the time after the program, she either joined the husband in that local government, either in Abadam or Monguno or Gubio, or even in Kwayakusar. You understand with me? But we don't pick somebody who is living in Maiduguri, and then at the end of the day, after the training, she will say, no, she's not going to Abadam. So we don't do that. For health, Women for Health is a program that was a grassroots program. We want these people to go back to our village where we are born, where we are brought up, so that they deliver women bearing age, so and then take care of the labor sector.
Started in Borno in April 2018, Women for Health is working with government and other stakeholders to achieve the desired objectives of bringing health care services closer to vulnerable people, especially women and young girls in the rural areas.
Any program that will really increase the number of highly trained health personnel would really impact the health sector and also the health of the indigents of Borno State. So, and you only do that through training. So this program has identified students in especially northern Borno, and quite a number of them have been enrolled into the program. So once their training is completed, they will definitely help the indigents of Borno, especially at the local government level.
For the past couple of years that we have signed an MOU with the Women for Health program in Borno State to particularly increase human resource for health at the middle level, and especially girl child education. A lot has been done and a lot has been achieved. Among the things we have set out to achieve actually were the issues of getting an increase in the enrollment of students into the College of Nursing and Midwifery, particularly the girl child.
This program has made a great impact in the state in order to train our rural community women to come and obtain a skilled birth attending or skilled birth attendants to attend to the giving birth mothers to reduce maternal mortality in the community. By introducing this Women for Health or Foundation Year program to train these rural community people, after training them, they will go back to where they came from to serve the community at the grassroots level. You know, people who are living in the rural areas, for them to obtain qualitative, affordable health services, it will not be easy for them because even the transportation will be a problem before reaching a health services. A Women for Health or Foundation Year program that is being introduced by Women for Health. Now, this system, I assure you that it will reduce maternal mortality to the barest minimum in the state.
The Women for Health have, in its wisdom, came up with a suggestion and idea on how best can we identify girls that will really be trained into the health professional system of midwife and the nursing. And they did that by identifying the vulnerable people who were already in the IDP camps. They are vulnerable because the wisdom of the Women for Health is for them to ensure that those that have been trained will be able to work in their respective communities, because many people who had been trained even by the state government could not go and work in the community, particularly the rural areas, because of poor access road, poor infrastructure, poor housing facilities, very poor electricity and potable water supply. So they decided to cluster themselves in the relatively urban centers and periodically going to the local communities in order to discharge their services and responsibilities. So Women for Health, by identifying that problem, have decided to pick from among those communities with an undertaking that if you are trained to be a nurse or midwife, will you be willing to serve in your community? Yes. Who are the stakeholders? Are they involved? Yes. The local government, are they involved? Yes. How can you persuade, even after marriage, that they will be allowed by their respective spouses to go and discharge their responsibilities? All these have been contracted in before they start to engage in them.
The Foundation Year Program, FYP, is one of the key components of Women for Health that focuses on supporting dreams of young girls from rural communities to become health workers and serve their communities. The FYP program in Borno collaborates with local councils, traditional rulers, IDP camps chairmen and other stakeholders to identify the vulnerable young women residing in camps or rural areas for the training, after which they return to their homes and provide culturally appropriate healthcare services for women and girls.
So we engage all the leaders in the camp as well as all the leaders in the local government. In the camps, we selected the chairman and the women leaders in order to support us in selecting the candidates, while in the local government, we involved the traditional rulers and the local government council to select and maybe forward names for us for selection. Actually, in the first cohort, we only took those who have the 5 credits. That is English, Maths, Physics, Chemistry, and Biology. You have to get that 6 credits for you to qualify to either School of Nursing or Midwifery, which have to abide by the rules of the school. Secondly, in the second cohort, we also gave another opportunity for bridging. Those who don't have the requirement, we will train them and then allow them to sit for work so that they can meet up the demand or the requirement of the school.
The aim of the FYP is to empower women at the rural area. That is the principal aim. So when Women for Health came, they devised a means and call it FYP program. They will go to rural areas in the rural communities and recruit or admit candidates from the less privileged families and come and train them to be nurses and midwives. We started the first cohort in 2018 with 120 students. After 6 months of lecturing, they were admitted into the health institution. In fact, 50 of them were admitted into the basic midwifery program, 38 of them were admitted into the community midwifery program, 8 of them were admitted into the basic nursing program, and 16 of them were admitted into CHU program, the health technology institution.
Sociocultural disadvantage, exclusion, poverty, power and educational provision in the rural areas are some of the factors which deter young women from being admitted into health training institutions. Women for Health, under its FYP program, provided 1-year bridging program to hundreds of girls with prerequisite qualification or cannot pass the entry examination into health training institutions.
The Foundation Year program has 2 components. We have the bridging and then we have the preparatory. Preparatories are those that are having 5 credits but they cannot measure up to their 5 credits. Then the bridging, those that have 3 credits, 4 credits from the local government areas. You know the problem we are in this as a result of these insurgencies. Most students cannot get 5 credits. Even those with 5 credits, they cannot defend the 5 credits. So as a result of this Foundation Year program, they have been coached. They were able to compete favorably with their counterparts who are in the city. You will agree with me that some of these Foundation Year programs, when they graduate from the Foundation Year, they have been admitted into community midwifery, basic nursing, and even those that cannot perform well, they are given empowerment. Yes, Women for Health help the students pay their school fees. Women for Health pay their registration fee. They give them stipend at the end of the month. Some of them, out of what they have, they can even assist in their families.
If they are admitted into the program, they will be exposed to so many things. They have a lot of advantage. One, they will be given a token fee of 10,000 naira every month for their feeding and upkeeps. A qualified teachers will be there to teach them and coach them on how to write exams. They were given a free accommodation at the girls' hostel of the College of Nursing and Midwifery Medical, including beddings. Then they also have free medical care, and we have a crèche there for those who are nursing mothers.
This is in addition to the transport and feeding allowances to over 400 girls admitted into training this year after passing their examination. To ensure successful training of the over 400 girls in different fields of health services, Women for Health facilitated the full accreditation of the only 2 healthcare training institutions in Borno State. The Women for Health program supported health training institutions in the state with capacity building training for teachers and other physical infrastructures to bring about life-changing opportunities to women and young girls.
The Women for Health, I've been involved with the Women for Health for over 3 or 4 years, and I've seen their drives, which is commendable. And the government has partnered with the Women for Health in even getting accreditation for the School of Nursing and Midwives. And then the Women for Health, they have also built facilities which really assisted in the accreditation. And now even the number of students into midwifery and nursing has increased. And during the accreditation exercise, the government partnered with the Women for Health in making sure that the accreditation exercise was successful. So this is an excellent partnership which has started and will continue to be supported by the government.
The health training institutions are not adequately in position to observe the growing number of training the health power needs of the state. So the Women for Health have ensured that additional facilities and the training and retraining of the instructors of this health training institution. At the same time, the absorption capacity of these health training institutions have been enlarged from 200 to 600, which means apart from foundation year program that had been ushered in by the Women for Health, they will now give even opportunity for others to be observed, to be trained. And then accreditation. The Women for Health had facilitated the accreditation of these 2 health training institutions. They were given full accreditation, 1. 2, they were offered the opportunity to engage in what we call community nursing and midwifery. They embark in a program of special prerogative in order to ensure that the people who do not have basic prerequisites were already trained by these institutions.
The kind of support Women for Health gave us are numerous. One, in the area of human resource, because later to the Women for Health, we have provisional accreditation as a result of few number of staff. Women for Health employed 20 BNSC graduates, paid their salary for 1 year, and then they enter into a memorandum of understanding with state government. They are now being employed by the state government. And then in the area of construction, they constructed ICT center for us, equipped with computers. They constructed library. They constructed administration block, where the office of the provost and key officers are being housed. Then, as a result of the construction of this ICT and library, we were using our classrooms for library and ICT. So as a result of the movement from the classroom to the ICT, we have 4 additional classrooms. And then a brand new crèche was also created, constructed by Women for Health. And the impact of the crèche is that, you know, in those days, when a female student delivers, as a result of delivery, she might discontinue her study, go for maternity leave for 6 months, and then when she comes, she is demoted for another 6 months. So this has impacted now with the crèche and nannies. As early as 2 weeks after delivery, she can come and continue with her studies. You know, they did a lot of capacity building in the area of e-learning. So most of us now, we have e-learning. And then I forgot to tell you that they even equipped us with servers and e-learning materials, of which when this COVID-19 came, now we are better equipped because our students can access their lectures online. Since the inception of this college as a school of nursing and midwifery in 1971 and 72 respectively, they have been staying on provisional accreditation. What provisional accreditation means is that after every two years, the regulatory body, that is Nursing and Midwifery Council, comes accredit the program, and then we have not met the criteria to have full accreditation. So they will say provisional accreditation, we will have 50 intake. So with the coming of Women for Health, after all the provision of these equipments I have told you and the constructions and increase in manpower, the last accreditation by Nursing and Midwifery Council, which was in January 2020, we had full accreditation, which means we can now admit 100 for basic midwifery, 100 for basic nursing, and then another increase of 200 for community midwifery.
The Women for Health really did a lot of things, and they carried out a lot of activities. They trained the staff, so they helped us in the capacity building. Not only that, but also really constructed a complete department of community health, which is clearly for the first time in the history of the school or the college as a school when it was established about 40 years ago. Really, the impact is very, very great in terms of training, capacity building, providing equipment, textbooks, facilities, a lot of things really has been done by the Women for Health.
Women for Health became the pace setter in restructuring the healthcare system of Borno State, which was ravaged by the insurgents. As such, when these women and girls under FYP program completed their trainings, they will impact positively at the rural level. As a result of the impact made by Women for Health program in the benefiting states across northern Nigeria, 7 other states have so far adopted and domesticated the concept. Similarly, Borno State government has equally taken giant steps to continue with the program. So far, the Borno State House of Assembly has passed into law the concept of Women for Health.
The content of this bill that we have just passed, now it has been even assented, but yet to be gazetted and the state. You know, the main content of that bill, you know, initially the aim is to train those who are less privileged local governments or less privileged people who are not yet, I can say, enlightened with the present intention of this Borno State governor. Now, he now directed this program now to recruit 5 students from each local government. From every political unit, those women will be selected for the training. So every year, 135 students will be enrolled into this program.
Life-changing opportunities is another component of the Women for Health program that raises aspiration, broadens horizon, and increases self-confidence and esteem for beneficiaries.
No words can express my delightness to Women for Health for sponsoring our program from the very onset to this present stage. I would like you to know that this program are for less privileged persons. I used to have the zeal to go to school, but I wasn't opportune to do so. But Women for Health gave me this opportunity, and I'm very grateful for that.
I am a student of College of Nursing and Midwifery. I would like to convey my appreciation to Women for Health. No word can really capture the joyous feelings in my heart when I think of how Women for Health has touched my life. With the help of Women for Health, my dream have come true. And I would like to say this gesture is timely at the moment when insurgency had rampaged into our community, which will lead to several personnel, including health professionals. And also, this gesture will go a long way in reaching out to those people in the community who lack proper healthcare services.
Some parents, traditional and community leaders wore their minds on how Women for Health change lives in their respective communities.
Yaranmu an zo an ɗauke su an samu ci gaba har gashi sun dawo a cikin camps wajen asibiti suna taimakawa a 'yan mata 'yan uwansu a wajen aifuwa. Gaskiya mun ji daɗin wannan abun. Wannan program mun gode musu.
Mun yanzu dai mun gode Allah, 'ya'yanmu ne
wanda suka yi karatu da Allah ya tambake su sun samu yanzu ƴaƴanmu su suke kula da mu a cikin asibiti namu na Bakasi da sauransu. Sun zo suna taimaka ma sauran doktoci, suna taimaka mana da aiki da kula da rashin lafiyarmu da sauransu. Allah ya dade mun gode Allah.
Sunana Adama Abubakar, ni cikin kam na Bakasi ne. Gaskiya zuwar mutanen nan ya matuƙar taimaka mana saboda ko in ba mu da lafiya muna tare da su. Yanzu da na zo asibiti na kalla 'yan uwana ne a wurin, sun bani magani, na yi matuƙar jin daɗi.
To ensure that no one is left out, the Foundation Year program enrolled other candidates who failed at the entry examination into the health training institutions to vocational training to acquire skills in order to become self-reliant. At the end of their training, Women for Health provided them with startup capitals.
Women for Health, Kaufanda Amzuza, Ndia come doing Monty Kratubadis not doing not here, so Akras not doing Kakadin Jarawai. Credit U, she out in secondary school to Monimia, Jarawa and Pandimin Mare, come Nanzim Bio, so Shamazin, there is a Shabanazin Monte Krajana, Alara. Alabara Sakumen Health and they're out in Sidimba. I'm the hostel and come to Wanye, Ishe hostel in Namyana and Dero Katipa so, Bokotiso, Deruso, and Dero Jumbunaso, and Dero Hatakuna Kumbui, Kurumso, Sama Obama Bow. Sadi exam the buy and the land is a sooner ama atmai and the buy and the magana. Do I ausra na rosa sadai namye aura and sundu soronye. Dailande, tailoring ronye, lande and the queer ronye, lande aulason and the daikwa, daikuria chidina, do I am doing out in Srodum Guzna mother, near our mother.
Mun gama training alhamdulillah sun ba mu keken dinki, generator, su scissors nasu, zaran su ba abin da basu bari ba, abin da ya buƙaci a keken dinki duk sun ba mu alhamdulillah. Gashi yanzu alhamdulillah mun dogara da kanmu.
The coronavirus is one of the deadliest pandemics that rocked the 21st century. Over 2 million displaced persons living in densely populated camps in Borno is a source of concern not only to Women for Health but to all health-related organizations around the globe. To avert the spread of the disease, Women for Health trains women at the grassroots to educate camp dwellers on how to protect themselves from deadly COVID-19. Not only that, Women for Health also came up with trauma healing as well as guidance and counseling to trauma victims in internally displaced persons camps in Maiduguri.
Yalande Women for Health sad isanade isa tera za andero andia putudo die kelande sasa nyenma andero isa fuleza misalo amdela zoro tunane su da har sai hawan jini su kana mare dai putudo die hawan jini rigana andela zubcin no
turoma ari ka turoma isnare taidange kijin zafanga burun lenge kunguna ni so kawgana sitale ngana kemisin purna so yu kinda ma kirma isu yu kimbaro ollon awajo yaru waja suwa dikin bunebo in ma dikin taidange kijin zafanga.
The government and people of Borno State appreciated the government of United Kingdom for the program, which has achieved a lot in not only increasing the number of female health workers but revitalizing the entire health system of Borno State.
On behalf of His Excellency Professor Babagana Umara Zulum NMI and the entire people of Borno State, I would like to commend Women for Health for a job well done, and this will really change the way healthcare is perceived at the grassroots levels.
In Borno State, Women for Health is not just a win-win program, but a concept of life-changing program that added value to people-centered healthcare service, whose impact has positively touched the lives of every family, directly and indirectly.